With many businesses closed down and a stay-at-home order in place, there's been a drop in emergencies.
We've had a reduction in people coming in. To a certain extent, we expect that because as people have been staying home, they haven't been driving. There's a certain number of emergencies that are not taking place, and it's great that there's no car accidents and people aren't getting injured.
As the medical director at the emergency department at Cedar Sinai Medical Center, Dr. Sam Torbati says he expects certain medical emergencies to continue.
Things like heart attacks, strokes, certain medical and surgical emergencies, bleeding conditions, conditions like appendicitis, conditions that need surgery.
When you speak to some of these patients, what is the main justification they say, some of the reasoning they put forward for not coming there on time?
For the most part, they're afraid that if they come to the hospital, they're going to pick it up. We can't quite understand why, because in hospitals, we have all of these systems in place and processes and protective gear. We triage and we assess people to see who has symptoms of COVID-19 and who doesn't.
At the Centinela Hospital, another major medical center in Los Angeles, ER physician Dr. Paryas Patel is also observing the same phenomena.
This Centinela Hospital typically receives about 180 to 190 ED visits a day. Currently, we are in the upper 90s, so you can just, by the sheer volume, you can tell it's half.
Many of these patients make it to the ER out of desperation, later than they normally would, and with more medical complications.
The fear and panic that they're going to probably be in a hospital, get more sicker. So what we are seeing is more of a sicker population, and unfortunately, a lot of these people have waited long enough. So now, without adequate care, they're getting more sicker and coming with the same disease that could have been treated a lot more easier.
Some end up becoming inpatient stays at the hospitals, while their symptoms on the first day could have been treated much easier.
In general, my advice to all patients is, if you have symptoms and you're not feeling good or you're dragging out, do not wait. Come and get adequate. The hospitals have mechanisms to figure out. Centinela, I can assure them that we have the capacity to take care of them.
A common message from all hospitals dealing with the COVID-19 pandemic, that they still continue their normal operations for all other healthcare services. It is Tiyansan, CGTN, Los Angeles.